Are you a new dentist trying to navigate the world of UDAs? I know you might think that the more UDAs you complete, the more money you'll make. But what if I told you that focusing too much on UDAs could actually hold you back in your career? In this video, I'm going to explain why starting with fewer UDAs could actually be the smartest move you've made in your career and how it can lead you to greater long-term success. Stick around to find out why less is more when it comes to UDAs. So let's start with the basics. What exactly is a UDA? UDAs stand for Units of Dental Activity. It's the system that NHS dentists are paid by, and these units essentially measure the amount of work you complete over a year. UDA values are awarded to individual practices depending on number of patients, the area, etc. So each practice will have a different UDA value, and then the amount that the dentist gets paid per UDA is negotiated between the associate and the principal. Now, going back to my why the NHS is broken video, I mentioned this practice in northwest London where the dentist is getting paid about £10 per UDA. So if this dentist had to choose between doing 3,000 UDAs or 5,000 UDAs, they would obviously choose 5,000, right? Because the more UDAs you complete, the more money you're gonna make. But what if I told you that is not necessarily the case? I remember being a foundation dentist looking for associate jobs, and I had no clue how many UDAs I should be taking on. I mean, I always wondered as a foundation dentist how I'm supposed to come out of foundation training year and be able to guess how many UDAs I can commit to in my first associate year when I don't really have anything to compare it to. On one hand, you don't want to overpromise and suffer clawbacks that may occur at the end of the year. But on the other hand, you don't want to underpromise and compromise your earnings. Everyone I asked about UDA targets had one specific suggestion to give me, and it was 1,000 UDAs per every day that you work. So for example, if I'm working 5 days a week, I should be doing 5,000 UDAs. If I'm working 3 days a week, I should be doing 3,000 UDAs, etc. What if I told you that I have some tips that will help you more than this arbitrary number? Let's jump into tip number 1, which is less is more. Key to an associate dentist succeeding in a brand new practice that they've just started to work at is discovering what the pace of the practice is and discovering what the patient demand is. You need time to adjust to your new role. You need to get familiar with the practice. You need to build rapport with your patients, and you need to work on your own pace. Starting with a lower UDA target can actually be a great strategy, especially during your first year as an associate. When I first started, I decided to take a contract of 3,000 UDAs per year. It's because I didn't want the pressure of being able to hit a huge target. And it was my first year out of foundation training, and I just wanted to find my feet. Now, I know according to this 1,000 a day rule, 3,000 was pretty low for 5 days a week. I definitely could have taken on more. I mean, I had colleagues that were telling me they were doing 5,000, 6,000, 7,000, but for me, I don't think that felt right. Starting with fewer UDAs really gave me room to breathe, and I would really recommend it. It's all about making sure that you start at a good pace that isn't going to allow you to feel burnt out or rushed as you're transitioning into your new role. This approach also focuses on building skills and confidence and making sure that you're not taking on too much, especially taking on a target that can penalize you if you don't reach it. Tip number 2 is that UDAs are not everything. One of the most beautiful things about being an associate is the flexibility that you get. You can always adjust the number of UDAs that you initially take on. If you started with a low number of UDAs and you find yourself getting more comfortable, you can always renegotiate your UDA target later on. Alternatively, if your practice can't accommodate that, you can always work part-time at another practice that can give you a few more UDAs to do. Or even better yet, you can focus on other aspects of your career, whether that be private dentistry, whether that be patient management and time management, or whether that be going on courses to improve your clinical skills. Here's something that surprised me whilst working in the NHS. Although my UDA rate and the number of days I worked remained about the same since when I started as an associate, my income has gradually been increasing. I found that as I was becoming more experienced, I was able to communicate the value of my work to patients. I was able to offer them more than just a standard massive amalgam filling or the ugly metal crown that they were used to. I was able to understand what the patient wanted, and it wasn't always the cheapest treatment possible. Sometimes it was a crown that was the most durable and looked like a real tooth when they smiled, or it was a denture that was more comfortable, easier to clean, and prevent prevented gum problems, or it was just a more sophisticated treatment option than what I was able to provide on the NHS. Whether it was general private treatment, Invisalign, tooth whitening, facial aesthetics, I was able to raise my income not by doing more UDAs. When you become more confident in your skills, you may find that doing work independent of the NHS offers a significant opportunity to boost your earnings and provide a greater variety of services to your patients. In my opinion, private dentistry is not only more profitable than the NHS, but it's also much more fulfilling. Tip number 3 is learning how to balance NHS and private work. Within a few years of practicing, my mindset changed from how many more UDAs can I do to how can I do less UDAs because it's getting in the way of me doing the work that I like to do. Here's how I saw it before. NHS income is like a stable base salary that I can budget for each month. And private income is like a bonus. Sure, it's unpredictable, but it gives me a bit of freedom, a bit more spending money. Here's how I look at it now. I was working 4 days a week, spending 80% of my time doing NHS work, of which 50% of my earnings came from the NHS. The rest of the 50% was on private, on which I was only spending 20% of my time on. At this point, I was just feeling like a hamster on a broken wheel of NHS. Yes, if you're new to dentistry, the NHS or the dual approach is great, as NHS income does give you stability, and private work gives you flexibility to branch out and increase your income when you're ready. But in my opinion, the perks of being an NHS dentist are super limited these days. I've seen that in the past decade or so. The shift from NHS to private has been quite major. I'm assuming this is due to government policies that many dentists have been trying to change for years. Before this shift, being an NHS dentist was the norm and it was most likely worth it. I wouldn't know because I missed that train, but on that note, let me get into a few perks of being an NHS dentist. Perk number 1 is maternity pay. If you're a dentist and you've been on the NHS performer list for 2 years and you've been in 26 weeks of employment, then you're entitled to maternity pay, which is based on the net pensionable earnings. Usually that's to do with how many UDAs you've done in a year and some other bits that I am not quite sure of. But anyway, you get 26 weeks of maternity pay, which is taxable and pensionable. Private dentists, however, they must rely on savings, child benefits, or dividends if they have a company, as they won't be entitled to any maternity pay. Another perk of working in the NHS is the NHS pension, which don't get me started on because I actually don't understand it. I've always been told that it's a great pension scheme, and recently I've come to discover that it's really complex, and I don't know again what the benefits of me being part of this scheme would be, because things are just going downhill with the NHS. I'm sure in the past, people that are going to be retiring in the next 10-20 years, they are getting a lot of benefit from being a part of the NHS pension scheme. I just don't think our generation is going to be getting that many perks from the NHS. So to recap why you shouldn't chase UDAs, number 1 is less is more when you're starting out. You shouldn't feel pressure to take on too many UDAs in your first year as an associate. Just focus on developing your skills and adjusting to your new role. Number 2, UDAs are not everything. Remember to diversify your work and don't get sucked into just doing UDAs. It will limit your potential in the long run. Number 3 is balance is key. Private income can be a great supplement to NHS income, so don't ignore the opportunity to grow your patient base. Don't fail to mention to your patients that they have other options that may be more profitable to you as a dentist, but also will be much more beneficial to them as a patient. And number 4 is there are some perks of being an NHS dentist. Some people like the fast-paced work and the guaranteed income that the NHS provides, but you need to weigh up what is more important to you. I hope this video was useful and it inspired you to take off your UDA seatbelt. If you're a dentist, then please comment below if you have any more thoughts and tips. And if you're a newbie, a student, a foundation dentist, or a new associate, please comment below if you have any more questions and I'll be happy to answer them. That's all for this video. I will see you in the next one.